Okay, I think we are back on. Sorry for anyone who might have been kicked out. All right, so we're just going to jump right in. So we are covering men's health and optimizing stress hormones, metabolism, male hormones. This overall, I'm trying to take a systems-based approach. So we're talking about how each of these systems play into one another. And we're going to get into details about kind of how we want these to be functioning and how, in general, they start to break down, both with age, but also lifestyle circumstances. Really, what I want is an overview of the different ways that these systems play into each other. We'll get into some strategies on how to get things going right in the body. But before we get into treatments, I want you guys to understand the good foundational aspect as to why we're looking at the body and the system from this way. Of course, we can go into more specifics with anything that male hormones essentially are affecting when they start getting a little bit less optimal, starting to get to that andropause level. But overall, we're going to kind of look at the systems of stress, metabolism, as well as male hormones. So, to the next slide. So, why are we focusing on men's health? Well, we're seeing men experience burnout, metabolic resistance, hormone changes. These are all occurring earlier than previous generations. There's literature showing that where testosterone was back in the 80s as to where it is now for the general population, it's not quite the same. There are various factors as to what that is about, but overall, we are seeing these lifestyle burdens really take a hit on men's overall testosterone levels, both free and total. This isn't because men are weaker. Generally speaking, we're having a little bit more of a demand on modern life. Recovery is at its all-time low, while higher stimulus, higher output is being pushed. So we're not really trying to jump into a fear model, but just understanding how that we can build resilience going forward. Generally, men face early mortality earlier than women. Health has often been reactive as opposed to proactive with men's health. So we're really going to try to focus on thinking what we can do before things start to deteriorate in the men's health arena. Metabolic disease begins silently. Generally speaking, these small physiological changes don't scream out as a problem until we see them compound over the years. So we want to be able to start screening a little bit earlier, both with lab values as well as physical exams, to sort of see the trends in each of our bodies as we take on the burdens of modern life more and more. Burnout becomes normalized. So high output without recovery will have a cost. We see people touting themselves as having low sleep, but high output at work. And in the short term, this can lead to high yield, but it's going to overall, in the long run, be a little more detrimental for overall men's health. A little bit about your presenter today. I am a licensed naturopathic doctor specializing in men's health, metabolic resistance, hormone optimization. I've earned my doctorate degree as well as my master's in clinical psychology from Bastyr University. I also hold a genetics background, studied genetics at UC Davis, helped me get into the biochemical pathways a little bit earlier in med school. And I also am very passionate about men's health in terms of integrating both a systems-based approach for physiology, as well as understanding the deeper psychology in ways that we can help restore men's health, their energy, their strength, their long-term vitality. I was born and raised in Southern California. I'm passionate about empowering men to take ownership of their health. And outside the clinic, I like to enjoy strength training, basketball, yoga, spending time outdoors, anything creative, really, be it music, poetry, something that keeps the right side of my brain going. So, learning objectives. What we're going to learn by the end of this course, we are going to cover the physiology behind burnout, how insulin resistance impacts hormones, why visceral fat changes tend to lead to differences in testosterone signaling, as well as normal aging versus system overload. We're also going to take a look at what labs we actually want to look into for functional parameters, as well as practical steps for rebuilding energy and resilience. This right here is going to make more sense as we go through each system. This is the capacity model. Essentially, what we're trying to tie here together is the metabolic function bleeding into hormone function, as well as the nervous system function. If we can kind of take a look at the subcategories, metabolic function, we're talking about insulin, inflammation, energy, hormonal, sex hormones, cortisol. And with the nervous system, we're really focused on mood, stress, and sleep. All of these three, when balanced and aligned, we're going to see our capacity go up. We're going to see drive go up, recovery go up, performance go up. And generally, when we see one diminish, the burden starts to lie on the other parts of the systems. And that's what this next slide is about. It's kind of showing you how each of them feed into one another. And when one system is burdened, we might be able to tolerate it for some time, but it's only a matter of time till the second system starts to get overburdened. And by then, we're really putting all of our energy on constant state of inflammation as well as recovery. And that leads us into a dysregulated state of being lower vitality, lower overall health. So we really want to be able to figure out what the root cause of our issues are by kind of keying in on these systems and seeing which one needs the most support and how they fluctuate over time as we do begin treatment protocols. So what I want to highlight here is that stress is not the enemy. Benefits of acute stress response include increased productivity. It helps us with responsiveness. It helps us remove distractions. Basically, it helps with our overall execution and making tasks more efficient. With this, we have a picture over here of our fight or flight as well as our rest and digest. Generally speaking, we have our sympathetic nervous system. So that's going to be our fight or flight. That's what gears us up, ready to go. And as you can see, sympathetic activates a sharper focus. It helps us increase neurotransmitters like dopamine, norepinephrine. This helps sharpen our focus, improve short-term task execution. Rest and digest is more the parasympathetic response. And we can get into that a little bit later, but I want to focus on why we actually engage in stress and what the benefits are that come from stress. Lastly, we have acute stress enhancing performance. Adrenaline increases heart rate, oxygen delivery, cortisol increases blood glucose to supply working muscles. So all of these are different factors that lead to us being more ready and able to engage in whatever might be stressing us out. This right here is what we used to be using a lot of our stress response for. Stress in action is generally a byproduct of adrenaline and cortisol rising briefly. These are for short-term bursts of cognitive enhancement, cognitive performance, as well as in this paper here discussing the acute stress leading to increased glucose availability, so our muscles can actually use the fuel that is inside our bloodstream. And like I mentioned, this is generally what we're dealing with in terms of what stress was designed for in terms of the body. We spent a lot of times in a hunter-gatherer model, many generations passing on genes that allowed us to appropriately gauge into the stress response such that we were able to run away from a saber-toothed tiger or defend our family from any kind of danger or be able to track through long periods of times in a situation where we do need to retreat from maybe an in-hospital environment. What we don't want is this stress response to now be mixing with our modern life in a way that leads to downstream complications. And what exactly am I talking about? I'm talking about burnout. The modern man has a lot on his mind, a lot of environmental impacts assaulting the body. Generally speaking, stress can come from both a internal stimulus like thoughts and impressions, as well as external, like I mentioned, from the environment. And we don't want to see ourselves burning out to the point of essentially looking like this individual here. What you might notice in terms of stress and the stress response is people who are in a state of stress have issues with cognition, both with mood as well as thought process. So maybe some trouble concentrating, some apathy, losing interest in things that you once had a lot of interest in doing. You might see them showing up in physical manifestations like headaches, anxiety, anger outbursts. Other men, they might experience it in the gut. Stomach problems are strongly associated with any kind of mental disturbance or cognitive disturbance. So the majority of our serotonin is actually produced in the gut. And when we see the gut go downhill, we also see cognition, we see mood, and vice versa. Sometimes we see our thought processes, our stress impact affecting our gut. So it can be bidirectional with the stomach. Fatigue, general fatigue, it takes a lot for the body to be in this constant state of stress. And with that, we see some of our other functions like reproduction, like I mentioned with GI, these kind of more investing our energy towards either digesting our nutrients or using our nutrients to reproduce in terms of sex drive. Those all take a big impact when stress is prolonged over a long period of time. We might see some skin irritations such as acne or folliculitis developing, muscle tension, that constant state of being in a stressed mentality even can lead to the muscles holding and gripping, and that burns a lot of energy and not in a way that's optimal that builds muscle or leads us moving forward into the future in a way that we want to be strong and together, but just taxing the muscle and overburdening it for not much gain. Generally speaking, these mindfulness-based stress reduction techniques, anything that allows the body to sort of relax, you'll notice that fatigue component go away as well as the muscle tension, the muscle pain to decrease as well. Other symptoms might include teeth grinding. You might notice some TMJ after sleep if you are someone who teeth grinds after sleep, but you might also notice it after a long day of work or after an hour of a very stressful event. This teeth grinding can become problematic both for, overall oral health, but also for tension headaches. This constant state of clamping down on our teeth is not good for our overall body and health. So what's really going on? Stress, like I mentioned, can be beneficial when in an appropriate balance. We have homeostasis. We're able to balance our highs and lows and generally regulate ourselves both from our thought processes as well as from our biochemical pathways. But chronic stress, as you all know, can feel like a cloud hanging over your head, can be very burdensome for the overall picture. Negative effects of chronic stress. So this means that we're looking at all these different systems that give us an insight into what happens when the body is in a constant state of stress. We might see cortisol impacted. And cortisol is an interesting hormone because we talk about lowering cortisol often in integrative medicine, but it's not just about dampening our cortisol response. We really want to be able to test and measure, often through saliva collection, but testing the rhythm of your cortisol, meaning that in the morning, we want to see a steady peak. We want to see that cortisol rising. A lot of things can help with that process, like getting early sunshine, that period in the sunrise time when the sun isn't quite fully up, but on its way up can really help our body regulate and have a nice cortisol rhythm. We'll see over time cortisol starts to drop within the day, but when we see it drop too low or too aggressively, that might be an indication of cortisol dysregulation. So it's really important when testing for cortisol. We're doing a 24-hour collection, getting a collection in the morning, a few more samples later in the day, and this allows us to see the trend of how our cortisol is acting because sometimes we have dysregulated cortisol in a completely flipped way, meaning that cortisol's peaking at night and extremely low in the morning. So if you're waking up groggy and feeling like you're a slow starter and it just takes a long time for you to get going for the day, you might have a cortisol issue. And this can come from a variety of factors, but generally speaking, chronic stress is a big impact on our cortisol. When cortisol is dysregulated, we see decrease in immunity, sleep quality, as well as recovery. Insulin sensitivity, we're going to go a little bit deeper into this for the metabolic portion, but generally speaking, when we have insulin sensitivity decrease, tissue fails to respond to insulin signaling, fat storage goes up, blood sugar increases, and lipid levels increase. Inflammation, we generally will have a higher level of inflammatory cytokines when under chronic stress, meaning that our body is really fighting the burden of staying in a chronic inflamed state, which is not comfortable and is not something that we want to see in terms of long-term health outcomes. It does lead to different types of dysregulation of the body as we chronically stay in an inflamed state. Tissue repair will also go down when we are constantly dealing with this inflammation burden. Testosterone is also impacted by chronic stress. There are numerous studies that show fertility levels decrease when the body is under this kind of chronic stress burden. Visceral fat will increase, and that conversion of testosterone to estrogen actually goes up as visceral fat increases. And what are we talking about with visceral fat? Well, we're talking about the fat that's around the organs, that's generally in the abdominal area. And this is the type of fat that really leads to issues with your triglycerides, with your overall blood chemistry panels. We're not going to see things that are ideal in terms of getting our labs back when we're dealing with a lot of visceral fat, as well as that conversion of testosterone to estrogen. The net effect essentially is lower free testosterone when under that chronic stress state. Recovery, like I mentioned, is impacted. That sympathetic tone being raised means that we're going to be unable to engage the parasympathetic rest and digest. Sleep disruption will occur, growth hormone will go down. Generally speaking, our growth hormone spikes around midnight. That's when we start to see the levels of our body increase, and things like having high cortisol at night or not getting a consistent amount of sleep will lead to growth hormone decreasing. And with that, our recovery capacity goes down, our performance levels go down. Now let's get into the metabolism portion of this talk. How does metabolism play into our capacity? Well, metabolism is essentially foundation for male performance. Metabolism is converting food into energy, which is required for breathing, circulation, cell repair, temperature regulation, and even at rest, we're looking at metabolism being in play. And that's sort of what we're talking about with that basal metabolic rate. If you've ever heard of that BMR, that's how many calories we're burning just through our breathing processes, keeping our organs functioning, essentially keeping our body alive, is going to burn a certain amount of calories. And that shifts depending on where we're at in terms of how our metabolism is functioning. In general, men will have a little bit higher basal metabolic rate than women, but for a variety of reasons, this can be impacted over time. One big thing that does persist and keep basal metabolic rate higher is having more muscle, skeletal muscle specifically on the body. That's going to keep our body burning calories even at rest at a higher rate. There is the thermic effect of food, the breaking down of our foods and using it for energy. But also metabolism is important for insulin sensitivity, inflammation control, hormone responsiveness, energy production. All these different pathways are being affected by how well our metabolism is working. So we'll talk about insulin real quick here. Insulin essentially is the muscle and fat gatekeeper. I have a picture here of insulin as well as glucose. Insulin is really going to be responsive to proper receptor controls. So having a good connection between insulin and the insulin receptors is how we're going to feel in a chronically beneficial state as opposed to a chronically inflamed, chronically tired state. When our body is able to process and use insulin effectively, we don't see these we don't see these big peaks and valleys in terms of energy and performance production. We see insulin working to move nutrients into the muscle, supporting glycogen storage, which is where we're going to be putting our carbohydrates, as well as suppressing fat breakdown. This is also influencing our sex hormone binding globulin, which we'll get more into when we're talking about male hormones specifically. So what happens when insulin keeps going up? A lot of things can happen, but the main thing we're focusing on here is insulin resistance. Sensitivity, some say it's not the best to be a sensitive man, some are promoting it. That's for debate for you to decide for yourself. But what I do want you to understand is not all sensitivity is good and not all sensitivity is bad. Tooth sensitivity, generally speaking, pretty bad. Scent sensitivity, most people I know who have a really strong sense of smell, they're not big fans of it. But right here we have a insulin hormone, and insulin sensitivity, we're going to give that a two thumbs up. We love insulin sensitivity. We find that insulin sensitivity leads to our body being able to process insulin better. And when that is occurring, we move away from an insulin resistance model. So that's what I have for us here. Insulin resistance occurs when your cells stop responding efficiently to insulin and forcing the body to produce more of it to manage the same amount of blood sugar. So what we mean by that is as insulin resistance goes up, our body starts pumping and pumping and pumping more insulin out from our pancreas. And this is essentially our way of maintaining healthy blood sugar, even when maybe our lifestyle isn't necessarily supporting it. But this failsafe only works for so long. And that's what we mean by the insulin sensitivity and the insulin resistance. When we're eating a high carbohydrate diet, we're in that constant high glucose in the blood state, the insulin demand goes up from the pancreas. And this leads to these peaks and these valleys, these huge spikes in insulin that essentially soak up all the glucose, and then we're left with a crash. What really helps our energy levels down the line is both being sensitive to insulin, but also moving towards maintaining blood sugar at a level state, not having foods that spike our blood sugar, finding tips and tricks in terms of, let's say, making a sweet potato and putting it in the fridge. That actually can curb the level of blood sugar spike we get from a sweet potato. There's also fiber in sweet potato that helps with our blood sugar regulation. So there's a variety of ways we can get pretty inventive in terms of keeping our body in a more insulin sensitive state. But maintaining that blood sugar is going to be a great way to do that. And why are we focused on that? Well, that's because the risk of type 2 diabetes mellitus goes up as insulin resistance goes up. The changes start long before diabetes. Insulin resistance begins well before diabetes is diagnosed. Chronically high insulin levels, also known as hyperinsulinemia, can contribute to lipid dysfunction levels, visceral fat increase, as well as pro-inflammatory cascades. So generally speaking, before diabetes is diagnosed, before our fasting blood glucose levels are being measured above a 125, before HbA1c is starting to rise, we are actually seeing changes occur in the body. And there's some literature that supports us in that investigation. Elevated insulin is an independent cardiovascular risk factor. So from this study here, we were able to see that despite not necessarily being diagnosed with diabetes, we are already seeing changes occurring on the cardiovascular level that generally is not good for our body to be able to handle. Blood vessels lose their ability to relax properly, arteries gradually become thicker and less flexible, blood pressure becomes harder to regulate, and structural changes occur to the heart. This is years before diabetes is diagnosed. So we do want to be able to make sure that we are aware of our insulin levels, our blood sugar levels, getting our HbA1c checked. These are good factors to do, even if we aren't necessarily at risk for diabetes at our current state. The impact of high insulin is bidirectional in male hormone signaling. This is just indicating that low testosterone is common in men with type 2 diabetes, as well as those with metabolic syndrome. Visceral fat and insulin resistance lowers overall testosterone. So lifestyle interventions improve both metabolic health and testosterone levels more reliably than testosterone therapy alone. This essentially, right here in this study, we're seeing that despite testosterone being linked to type 2 diabetes, despite insulin resistance and testosterone having a relationship, just replacing testosterone alone doesn't necessarily have as much of a health outcome as getting your metabolic health right, as well as your testosterone levels right. So we're really looking at a integrative approach of improving our lifestyle as well as improving our overall hormone levels. Elevated insulin and pro-inflammatory states. This is showing that insulin, when it is chronically at a state of being higher than we'd like it to be, can lead to markers like IL-6, TNF alpha, CRP to elevate. And these are inflammatory cytokines. CRP more so is a measurement of our overall inflammation level, but especially the IL-6, the TNF alpha, we're worried about these being chronically inflamed in someone who has elevated insulin because it creates this cycle of producing more insulin, staying in an inflamed state, and never really getting into that rest and recovery portion that we'd like to get into. So when we have insulin at this high level, it's generally speaking not going to be good for our overall recovery and kind of lead us stuck inside this state until we get our insulin levels in check. 3 steps to sensitize our body for insulin. Our approach one is going to be reducing insulin demand. I'm seeing a couple of my images didn't come through here, but essentially what we have here is that we're going to structure our meals to support stable blood sugar, prioritizing protein and fiber. Those are really important. Fiber itself is not a macronutrient, but the benefits you get from having, let's say, 30 to 40 grams of fiber a day impact your body all over. We're talking about increasing short chain fatty acids. We're helping our body detoxify through our stool. And we're also helping our blood sugar decrease. Fiber is wonderful in that way. It may not necessarily provide your body with direct fuel, but it has a host of benefits for an individual who's consuming the recommended 30 to 40 grams of fiber a day. Protein, like I mentioned, that is going to be big for recovery. That is going to be big for putting on muscle. Muscle is going to be helpful in terms of sensitizing our body to insulin. So really focusing on having a good amount of protein, maybe 25 to 40 grams of protein per meal, as well as that 30 to 40 grams of fiber per day, and focusing on whole foods, getting our micronutrients through different plants and veggies. That's going to be wonderful for reducing our insulin demand. Supporting cellular respiration. This is where we can get pretty tricky in terms of how we exercise. There are different forms of cardio. Prioritizing zone 2 aerobic training is going to be wonderful for getting our body to process things on a metabolic level a little bit more smoothly. So in terms of zone 2, that's going to be keeping our body at a little bit lower of a heart rate than it would be if we were sprinting or going for a long run, but definitely more than just a brisk walk. We want to be getting into that range where we'll develop a light sweat after some effort, but we're not straining ourselves at our highest capacity. That's the good level of aerobic training that keeps our body able to recover, but pushing the envelope a little bit. So we do have an increase in cellular respiration. Strength training is wonderful, getting our quality of sleep really in check, and checking for any key nutrient deficiencies, magnesium, B vitamins, CoQ10. These are some of the vitamins that I see the nutrients that I see tend to be missing when we do vitamin panels, when we're checking in with more advanced lab testing to see what might be missing in the body, what could be a root cause of fatigue, could be a root cause of any kind of metabolic dysfunction. We generally want to be looking at these magnesium levels, these B vitamins, and a host of other nutrients that can be a good window into what's going wrong in the body. Approach three, we like to shift our body composition. So that's what I was mentioning with getting that lean muscle, more that skeletal muscle, and reducing the abdominal fat. This can be done through consistent training as well as prioritizing recovery methods, sleep. These are ways that we get the tissue more able to respond to insulin. All right, so we'll jump into hormones. Hormones are your body's output signals. Hormones are messengers that tell your body how to build, burn, and repair. Hormones are homeostasis. The goal isn't necessarily high testosterone, it's healthy signaling within the endocrine system overall. So, what testosterone does a whole systems look? Over here, we can see this picture that testosterone is involved in a host of different organ systems. We have the skin, we have the brain, bone marrow, muscle, we have the bone itself, as well as male sex organs. Testosterone is really going to be helpful for red blood cell production. So when we start seeing testosterone lower, hematocrit might lower as well. We really want to be checking during labs when we're doing testosterone replacement therapy what the hematocrit level is, so we're not worrying about the increase in red blood cells. We want to make sure that our body is taking any testosterone that we're putting exogenously in and processing it in a way that isn't detrimenting our overall health. That's why when we jump into these TRT protocols without having a full workup, without having consistent blood work, we can run into more problems than we'd like. But overall, we do see that testosterone is going to be helping us with our sex drive, our cognition, a lot of different factors in the brain. It keeps our skin healthy, lubricated, keeps our muscle mass up, and keeps our bone density strong, which as we age is going to decrease, especially as men get into their 40s and their 50s and their 60s. We do start seeing bone density suffer as well as overall skeletal muscle decrease. So having strong bones, having a good amount of skeletal muscle is going to be very vital for, like I mentioned earlier, metabolic support, but even more so to maintain overall health, as we see testosterone is affecting a host of different areas in the body. So, what does optimal versus dysfunctional testosterone look like? Healthy generally has robust signaling. We're having consistent energy through the day, strength response to training, stable libido. A big indicator that our testosterone is at a good level is morning erections. Our testosterone tends to be at its highest. When you do collect blood levels of testosterone, for example, we want to be doing that from 7 a.m. to 10 a.m. So that morning erection that you may have noticed that generally starts occurring in prepubescent, pubescent adolescence, we want to maintain that as long as we can into adulthood. And losing that or having less consistency with it is a good indicator that something in the body might not be processing at its optimal level. Solid recovery, sleep feeling restorative, all of these are good signs that our testosterone is operating the way we'd like it to, as well as our waistline staying pretty manageable with normal effort. If we feel that we're gaining weight, no matter how much we're dieting, no matter how we're exercising, it could be a sign that we're bleeding into andropause, which for men tends to occur around 40. Studies show that men will drop in testosterone levels about 1% from the age of 40 on. But there is indications that some of these changes can be occurring pre-andropause, or for lack of a better term, between 30 to 40 years old in men. So there's no time that's too early to be able to check into our testosterone levels so that we can see the trend. But generally speaking, we're not going to be getting into the testosterone replacement therapies until we're moving beyond that age of 40 or so. Generally, with fertility, there are complications that can come up if not done appropriately. So we really want to be waiting till we can see evidence of andropause before we jump into replacement and take a real integrative approach in terms of looking at the trends. So getting our labs done earlier is always going to be better for our practitioners as well as our individuals who are looking to optimize their health as they age gracefully. So signs of andropause. Andropause is essentially the male version of female menopause. It's different in that it's a little bit more steady, and it doesn't necessarily mean that men can't reproduce anymore. We might see a decrease in sperm motility as well as overall count. So there are some key differences in terms of how it relates to female menopause. But andropause is something that I feel is often under discussed. When I'm talking with clients, when I'm talking to patients, we don't see andropause in their purview as much as I would with the women I see in my practice. Persistent fatigue, as well as low energy, reduced stamina, weight gain. These are all signs from an energy standpoint that andropause is taking over our health in a negative way. Mood and cognition, we might notice lower mood, depressive symptoms, irritability or increased frustration, as well as anxiety or nervousness. Difficulty concentrating, as well as memory changes. There's research showing that men with lower testosterone levels do see a decrease in spatial awareness. So different aspects of the brain might actually lose its functionality as we start to lose our free testosterone and total testosterone levels. And lastly, with reproductive health, we have reduced libido, fewer or weaker erections, as well as a decrease in intensity of orgasms. Part of that functioning, we might be able to see signs of it by doing tests for the production of luteinizing hormone as well as FSH. These are hormones that are coming from the top of the brain, signaling down to the testes themselves to have a healthy level of production from testosterone, as well as overall sperm count. So as we see a decrease in those testosterone levels, our capacity to actually maintain, enjoy sex, have intense orgasms, that will decrease as well. So that could be a good sign that andropause is taking over one's health as well. So low testosterone is linked to higher mortality risk. This is another callback to why we care about men's health, why it needs to be discussed. Testosterone is not simply something that we take or we keep high in the body so that we can maintain muscle. Of course, that's beneficial, but it's really an overall health indicator in the body. This population study in specific found that in ages of men 20 to 79 with a 7.2-year follow-up, they were classifying testosterone as below 250. We see that low testosterone is associated with higher risk of death from all causes. This includes cardiovascular mortality. This includes higher cancer mortality. So with this population study and other mechanistic studies we've seen in the past, we're looking at how testosterone impacts more than just overall skeletal muscle and bone density, but overall health in males. So how are we going to connect the dots? Well, we saw how the metabolic system, when out of whack, can lead to visceral fat accumulation, can lead to insulin issues. Adipose tissue itself, that fat tissue, expresses aromatase. That aromatase is going to lead to visceral fat increasing. That visceral fat increasing leads to more aromatase action, and that leads to higher levels of estrogen. That conversion of testosterone to estrogen also means that there's lower circulating testosterone in the body. And men should have a healthy amount of estrogen. There is reference ranges that we want to see men fall under, but generally having too high of estrogen or too low of estrogen in men is going to be detrimental for long-term health as well as overall productivity. Nervous system dysregulation, we've seen that low testosterone is associated with depressive symptoms as well as low motivation, fatigue, and reduced vitality. Testosterone therapy itself has shown small to moderate improvements in the mood of men. However, just like we talked about with lifestyle interventions, when we're able to get an integrative approach and really work at getting the body in terms of recovery, rest, and performance in a state of alignment, that seems to have a better health outcome than just simply replacing testosterone alone from exogenous means like creams or shots. Those can be part of a health picture, but what we really want to see is tying all of this together, the metabolic system, the nervous system, as well as our hormonal system. And that's where we're jumping back to the capacity model. So a little bit more information now after going through this lecture. I'm sure that each of these functions, each of these systems mean more to you in terms of how they play into each other and how we can use them to maintain a high level of capacity, have a high drive, have high recovery, increase our performance. We'll get into what a naturopathic workup entails and how we're able to use our naturopathic workup to support our treatment plans. But generally, we're looking at a whole picture, symptoms, lifestyle, physiology, labs. We're trying to understand why the systems have shifted and do we have multiple factors kind of attacking one system? Is it maybe one big root cause? It takes a pretty involved, detailed history, but this involves getting a good family history, past medical history, integrating your lifestyle with your symptoms and trying to find what the commonality is as to what's burdening the body, what's leading to these levels of testosterone dropping or potentially the visceral fat accumulating. And in order that we're not doing guesswork, we do want to get targeted labs. So data guides precision. We want to make sure that we're following proper protocols, and we're really optimizing any investment in time as well as finances towards natural therapies, towards pharmaceuticals. We want to make sure those investments are backed by research, backed by personalized medical plans. Integrative approaches generally mean that we're clarifying the pattern, we're reducing system load, restoring signal strength, and escalating when appropriate. So when I mean clarify the pattern, what systems are under strain? When we're talking about reducing the load, we're talking about decreasing inflammation, improving sleep quality, improving metabolic function, supporting our recovery capacity, and as well as improving our signal strength. So, insulin sensitivity, like I mentioned, having a healthy stress rhythm, having our cortisol working for us, not against us, making sure the peaks are at the right times, making sure it drops at the right time so that we're not carrying our cortisol into the night, basically making it challenging for us to sleep, no matter how much magnesium glycinate we're taking or whatever sleep medications, sleep therapies you're trying. That's not going to work well if our labs are showing our cortisol is constantly at an elevated state. As same as the morning. If our cortisol is at a very high state in the morning and we're pounding coffee to balance ourselves out, we're just essentially throwing fire on fire. It's not going to lead to an overall balanced system. We're just going to inflame the system more, burden it more without actually treating the appropriate lab markers that are showing dysfunction, and escalating when appropriate. We're going to jump here to what was essentially in the clinic rooms of all the rooms at Bastyr, where I obtained my naturopathic doctoral medical degree. But this right here is fascinating. I hold on to it and I've used it with patients since, because of the way it breaks down the therapeutic order in naturopathic medicine and how we can work towards establishing foundations of optimum health, stimulating self-healing. All of these are going to be the approaches that work with less side effects, work more long-term, and can really be done by the patient in terms of understanding their own health and balancing their hormones, keeping their skeletal muscle high, keeping their nervous system in check. These are great, great things in order to kind of low-hanging fruit, make sure that we're tackling all levels of our therapeutic order. But what happens over time, especially if things haven't been addressed, is we may have to go up in therapeutic order, meaning natural symptom relief or synthetic symptom relief. These are generally stronger and higher in force in terms of interventions, but have a little bit quicker of a return in terms of reducing symptomatology and improving overall health. And lastly, we're just going to highlight some different treatment approaches that we can take. There are a host of ways to help the nervous system. There are a host of ways to help the metabolic system as well as our hormonal system. But really, what we're thinking about is how it's all tying together. So, when you do get an integrative intake, when you are taking a long, detailed history and making sense of your health journey, we're, as clinicians, constantly thinking of what natural therapies, what pharmaceutical tools, what lifestyle foundations can we implement that's really going to be effective for maintaining our overall health in the long term. Some lifestyle foundations we're going to see shift might be an increase in resistance training, a little bit more movement, things like postprandial walking after eating. That means that after our largest meals, we take ourselves outside for 15, maybe 20-minute walk. That has been shown to drop blood glucose levels in a dramatic way, really soaking up all the blood sugar that is coursing through our veins and putting it right into the muscle. Just a simple technique. You can always start off with one meal a day, 15 minutes, 10 minutes if you're in a time crunch. But you're going to start craving it. You're going to introduce it once a day, and maybe you'll find that you like to do it after every meal. But you will notice the effects shift. It helps with digestive support as well, so any bloating you might be dealing with might be improved. These postprandial walks are a great hack for being in a natural state of lowering your blood sugar after meals. Protein and fiber, wonderful ways of keeping our body in an optimal state. That protein, like I said, is going to help with our skeletal muscle increase, and that fiber is going to be great for our blood sugar regulation, as well as all the other digestive benefits that come from having a high fiber diet. Sleep optimization, following our natural circadian rhythms, making sure that we're avoiding blue light, maybe getting blue light blockers, but overall just doing our best to stay away from screens as we get closer and closer to bedtime. Stress regulation is huge. This is really, really where you got to be creative in terms of what works well for you. People can respond great from breath work. I've seen others do well with mindfulness based approaches, and just having recovery time in general, really thinking about where in my life am I not actually taking the time to let my nervous system come down and sort of let go of the day, let go of all the stressors that come. Most of us are living in a chronically stressed state, and that wreaks havoc on our hormonal health in the long term. So having our go-to mechanisms for lowering that is going to be key in terms of maintaining overall health. Alcohol reduction, alcohol is going to tank our testosterone levels. It's going to increase our blood sugar. It's just going to be a burden overall. And any environmental toxin awareness, we can get into specifics and really work towards reducing your overall toxin burden. But generally, low-hanging fruit that we see is having foods stored in plastics, not thinking about our Tupperwares, not thinking about how we're actually exposing ourselves to certain endocrine receptors that are essentially in our everyday life that we have to think about in order to kind of make sure our environment isn't causing more havoc on our hormonal health. And as we get into natural therapies and nutrient-based therapies, there are a host of different approaches, both from herbal, botanicals that have anti-inflammatory effects. We have different types of herbal therapies for liver detox. Our liver is going to be huge for detoxifying and filtering out things that we don't want in excess in the body. So if we have stagnant liver, we can always find ways to help get that moving and flowing so that the body is able to actually process all the different pathways that the liver needs to process. Targeting mitochondrial support will be huge. Adaptogens for stress resilience. There's so many ways that we can help the body and these three systems specifically through natural and nutrient-based therapies. Um, Unfortunately, for time's sake, we're going to have to go a little bit quicker on the pharmaceutical tools. This can be a whole lecture in of itself. In terms of hormone replacement therapy, testosterone alone isn't necessarily what we have. For those who are looking to keep their fertility high, there are other approaches that we can use pharmaceuticals to really see the needle be pushed forward in terms of testosterone levels and overall hormonal health. But it just takes an integrative approach in terms of looking at both your lifestyle, how best to administer any kind of testosterone replacement, be it creams, be it injections, as well as seeing if you are a good candidate for testosterone replacement, because there are contraindications and there are reasons to delay incorporating a hormone replacement therapy protocol. But these are very strong interventions. These are ones that, when under the care of a naturopathic provider or an integrated provider, you can really see things shift for the long term because we have systems and pathways built in that are designed to be utilized in the long run. But sometimes, like I mentioned, environment, hormonal health, this takes a hit as we live in our modern life. So when we can get lab values to support our treatment protocols and we see ourselves actually rising our hormonal levels to be inside that optimal range and not just in that suboptimal, we'll see ourselves increasing overall productivity and decreasing overall symptom burden. And lastly, I just want to talk about monitoring and individualization. Like I said, this is a very personalized medical approach. No body is the same. No protocol is going to be the same. We can always tweak things to make it a little bit more workable, be it someone that isn't capable of getting biweekly injections, someone who's more interested in doing things via creams. There are very different ways that we can approach these types of both hormone replacement therapies, but overall care for our metabolic and nervous health. And ruling out contraindications is huge. We don't want to be jumping the gun on any of these higher force interventions. Like I mentioned, with that therapeutic order, working with someone who understands the positives and negatives of these approaches is going to be key so that we can make lasting long-term changes that benefit the body and benefit our overall well-being and enjoyment of life. So that was our talk. If you have any questions or comments, you can leave them in the chat below. I'll take a look at them. Thank you for your time. Let's change men's health together. And bit by bit, we'll be adding more of these webinars over time at Regenerate Health Medical Center. We can get into more focused approaches, talking about erectile dysfunction, as well as maybe more specific strategies on how to work with our metabolic health, mindfulness-based interventions for our nervous system. There's a host of things we can do. This was meant to give you guys an overview of how different systems play into each other and why integrative approaches really work well to get men to be in a long-lasting state of optimal health. Thank you for your time.